Yes, hello, dear colleagues. Today is 17th of February, Saturday. As usual, weekends in Almaty. I just arrived from Tashkent yesterday evening and today in the morning. We had two aneurysm cases, one diagnostic and one stenosis and one subclavian stenosis, one vertebral stenosis, one patient with the subclavian vertebral stenosis and the intracranial aneurysm. And also the last patient was from Tashkent Medical Institute Hospital with the MC aneurysm and the intracranial stenosis. We did the coiling and at the end of procedure we stented the cavernous segment of ICA. All patients extubated. Now all of them okay. Then I had some delay in my plane and now in Almaty. In the evening we planned two endovascular cases and one disc herniation. Together with Marat Sarshaev, I'm planning to do after this case lumbar discectomy, endoscopic. And then we have patient with the left ICA, paraclinoid and ophthalmic segment, two aneurysms. Patient has some gastric problems and the second patient has gastric problems and maybe we will do balloon assist coiling or we'll see. Without aspirin, we usually prepare them with Brilinta, and if it's necessary we can place balloon without we can place flow diverter stent without any coils and aspirin. We'll see. This patient is awake. She has a meningioma, parasagittal frontoparietal region on the left side, and as you can see, this is a vertebrobasilar system, no supply. And on the right side, you can see clearly there is a supply from middle meningeal artery from right to left. It's quite aggressive meningioma. It could be atypical sometimes with the involvement of the bone, parietal bone on the left side. And let's see the sagittal sinus is patent. Still patent, and the size of the meningioma, let's measure. It's very easy with the Philips system. It's easy to measure, nearly 4 by 3.6 centimeter. And we are planning to do super selective catheterization of the feeding arteries, which will be the middle meningeal branch coming from backside, this one. I think you can see. Then there is a supply, and we will try to occlude retrogradely all these branches, including the right side. If it's not possible, then we can occlude from here, but very tortuous anatomy. And unfortunately, this is the last sonic catheter for today. I hope we will succeed, and let's see in next few minutes if it would be effective catheterization. And also there is a supply from the ophthalmic artery. There is a meningeal branch. There is a supply with the ophthalmic to meningeal, and the meningeal is coming to meningioma. Yes. Nice case. Okay, and patient is awake under local anesthesia. As our Philips machine at Almaty became older and older. Smart mask. Okay, we can use this smart mask. It's very helpful. Let's see where we are. Okay. Okay. I like to say the meningeal artery is a killer of hybrid wire. Okay. It's mandibular, maxillary branch, and it was the last hybrid wire. I hope it will be effective. Yes, and in Tashkent it was complex cases, and our colleagues and friends now started to do diagnostic with the cerebral system. It's artificial intelligence, and more and more thrombectomy cases in Uzbekistan, and I'm quite happy my colleagues start to deal with stroke. Okay. Yes, with Traxess combination with Headway-Do, it's more effective. But today we have now these tools, and I need to try to do my best without best instrument. Okay. All right. And the angulation of the meningeal artery. Yes, there is some angulation. Doesn't want to go. Oh, interesting. Yes, it was nice discussion on Neuradict about the basilar aneurysms, on proximal bifurcation and the distal. Yes, very complex cases, and I want to wish good luck to my colleagues. One of the aneurysms is planned for tomorrow. Then we can see the final result for those aneurysms. And yes, we have some trouble with neurosurgeons in Almaty. They say it's not correct to leave the meningioma after embolization, but we showed our cases with the significant reduction of the size and stop growing and disappearing of the meningioma. And I think the result of the trials with the subdural hematoma is quite promising. And now, after reaching such result with the subdural hematoma, I think the next step should be meningiomas. And yes, like a meningiomas, like a subdural hematomas, meningiomas after embolization, the resection of the meningioma is more easy, and less blood loss, and I think the regrow of the tumor is very low number, and I could not understand why. I can understand, but neurosurgeons still want to resect all meningiomas, but there is a rate of regrowth of the tumor. It's not less. Recidive of the meningioma is quite high, and also the gamma knife experience is quite interesting in Astana. Our colleagues had more than 300 cases last year with a nice microsurgical experience. They sent to gamma knife more than 360 patients, and the results are, I think, nice. And the other question is why it's possible to do gamma knife, but it's impossible to do embolization for the meningioma, because we can embolize meningiomas more than 3 centimeter, and for the gamma knife, the most of the meningiomas suitable less than 3 centimeter. Фентанил жасау керек болады. Ксифокам 16 миллиграмм. Сквитоник бар ма? Сквитоник. Yes, and this is a Adnan technique. I'm saying it's Adnan technique. I have 4 cc of 4 milliliter of lidocaine. It's a 2% lidocaine, and I sent 3 cc. Yes, I learned it from Adnan Siddiqui from Buffalo, and it's very helpful. Yeah. Okay. Less pain, and all meningioma, subdural hematoma. We switched to local and the last cases we can combine. We are planning to combine with some fentanyl because of the very nice vascularization of this tumor from anterior, both middle meningeal, and some branches coming from the superficial temporal artery. That's why we need additional medication. Так, трябва да шприцаш трасалш, не може быть трябва да киркват не 12 жена появиш? Yeah. I asked my colleague and friend Davlet to take some more Squid 12. We will start with Squid 12. I had қозғалмай жатасыз, қозғалмаңыз. I had yes, it's like this. Böyle check back test. Okay. Бұл test Devlet. Бұл енді бітті. Тез барын берші. Берші барын. Devlet. Келесі шприц жинай бер. Тағы бір шприц жинай бер. As usually, it's okay. And yes, some rupture. It's okay. It's inside the tumor, and we are not causing additional damage. Бұл пациентті резекцияға дайындап жатыр ғой, да? Дәулет. Yes, patient is scheduled for the microsurgery, and I think maybe this kind of embolization could be enough. Maybe not. I will try to inject more, but we cut as because of the second syringe came a little bit late, and the tumor is ruptured inside, but no problem. Usually it's not problem. It's stuck. No, it's okay. Now it's okay. It will be better if it will supply from outside to inside. There is some rupture between two layers of meningeal artery. And meningeal system is very interesting. You don't need to go directly, and there is all the time collaterals, all the time. Yes, let's wait a little bit. Maybe we can go from right, but might be right side already occluded, and there is another branch coming from outside, from it's not so nice, superficial temporal, but it could be cut, no problem. And the nice thing after embolization, after a few days, the tumor become like a toothpaste and like a pasta, and it's possible to resect without big effort, and it's going somewhere. Okay, we need to take some supplying arteries, but this is in between of dura. Maybe it's a finish. Maybe not. Let's see. Yes, the frontal part of the meningioma is still but it looks like also there is a supply from PL network, maybe. If it's supplying from PL arteries, and then it might be atypical meningioma. Okay. is going same place. Yes, and my colleagues from Presidential Hospital made a presentation on a local conference in Almaty with the city neurosurgeons from city hospitals and from medical university, and they tried to punish my colleagues and said, okay, why you are doing embolization without resection and etc. etc. I think it's a clear message. Why not? If we occlude all feeding arteries, it's like myoma in gynecology, and most of the myoma after embolization is shrinking, and the patient can give birth. And with brain, the character of the tumor is similar, and I think it's also possible to not touch. And other indication after embolization, it's also the prophylaxis of postoperative subdural epidural hematomas. There is a lot of options. There is a lot of positive side effects of embolization. Okay. Okay, it's going the same direction all the time, and I think with this microcatheter we will stop. Okay. Кайтам кресло. Yes. And the other professor trying to say all strokes patient could be survived. It's very stupid and strange situation. I don't understand. Let's see what's changed after embolization. Так, жарцы жабылды. Бөлечек көкіш не дейсің? The most part of the meningioma is occluded, and the OLED is suggesting to stop embolization, and is tomorrow, not tomorrow, on Monday. Usually in a couple of days we do. This Y connector is stupid. Кірмей жатағынан берсеші болды. Yes, we have all these Y connectors, and some of them from, yes, some of them from neighboring countries manufacturing with the 1.5 billion population. And not in all cases these Y connectors and devices are with the high quality. Sorry to say. Okay. Yes, it's a problem of stacking the material when you prepare another material. Yes, there is edema around the meningioma, that's why it's better. Okay, this is carotid system. Okay. Let's see what's changed on the right side. If it's not changed, then it's a possible way to go. But there is no supply from the right side. We closed the supply from the right side. Назад. Артқа. Вперед, алдыға. No meningeal arteries. Yes, I think it's time to stop. Thank you. Аяғыңыздың басын қимылдатып көріңізші. Аяқтың басын. Yes, she's moving with leg. Сол жағын. She's understanding. And now Davlet will do expert CT. And in next 30 minutes we will start next case. Қалайсыз? Жақсы ма? Қазір томография жасайды, жата тұрмыз. Ісіктің 70%-нен көбісін жаптық. Енді ана алған кезде ыңғайлы болады, аз қанайды. Вот, и контроль жасағанға ыңғайлы да. Сондықтан Құдай қаласа операцияңыз где-то понедельник, вторник болады ғой. Жақсы? Қозғалмай жата тұрмыз. Yes, patient is okay. Now Davlet will do control CT. And I will show you CT, then I will go to the discectomy, and my colleagues will prepare patient with brain aneurysm. I will wait for the CT and then we'll go to the operating room. Okay. Дали чекаш на къта на букли екран да стиснеш, къта на екран. Okay, this is a control CT, and you can see the brain. There's no additional meningioma, only one. This is meningioma, and how deep we were with the liquid embolic. You can see nicely. Yes. As on angiography, it's not visible, but here you can see it's quite deep inside the tumor. Okay, I will share control MR in couple of days, and you can see the edema, and my colleague Marat with Shahmet and Abzal will plan this case for resection. And next case will be 2 aneurysms on 1 ICA. See you in 30 minutes.